Your heart works tirelessly every day to keep you alive and active. Yet many everyday habits quietly harm it over time. Dr. Reed, a leading cardiologist, stresses that understanding these mistakes isn't about fear, it's about empowerment. By recognizing habits that put your heart at risk, you can take steps to change them and even reverse some damage. Here are 5 common mistakes that threaten heart health and how to address them. Mistake number 5. Insufficient sleep. Sleep is not a luxury. It's a biological necessity for heart health. Unfortunately, in the era of hustle culture, especially for those over 40, sacrificing sleep has become all too common. Many adults consistently get less than the recommended 7 to 9 hours per night, leading to chronic sleep deprivation. Why? Lack of sleep harms your heart. Chronic sleep deprivation affects your cardiovascular system in multiple ways. First, it elevates blood pressure, which forces your heart to work harder. High blood pressure over time damages the arterial walls, creating conditions for plaque buildup and increasing the risk of heart attack and stroke. Second, insufficient sleep triggers an overproduction of cortisol, the body's primary stress hormone. High cortisol levels for prolonged periods contribute to inflammation, weight gain, and even diabetes, all major risk factors for heart disease. Additionally, sleep deprivation affects your appetite and food choices. When you don't sleep enough, your body craves quick energy sources, often leading to high sugar and high-fat foods. This pattern can lead to weight gain, insulin resistance, and an increase in bad cholesterol (LDL), all of which stress the heart. Dr. Reed also warns of undetected sleep disorders, such as sleep apnea. Sleep apnea causes brief interruptions in breathing throughout the night, lowering oxygen levels in the blood and increasing strain on the heart. If untreated, it can drastically raise the risk of high blood pressure, heart attack, and even sudden cardiac death. How to improve sleep for heart health? Prioritize a consistent sleep schedule. Go to bed and wake up at the same time every day, even on weekends. Create a sleep-friendly environment. Keep your bedroom cool, dark, and quiet. Invest in a supportive mattress and pillows. Limit stimulants and screens before bed. Avoid caffeine, nicotine, and electronic devices for at least 1 hour before sleeping. Practice relaxation techniques, meditation, deep breathing, or gentle yoga before bedtime can help calm your mind and prepare your body for restorative sleep. Seek medical advice for sleep issues. If you snore loudly, wake up gasping, or feel excessively tired during the day, consult a doctor. Untreated sleep apnea and other disorders are serious heart risk factors. Mistake number 4. Poor nutrition. What you eat can either build or harm your heart. Diets high in sugar, trans fats, sodium, and processed foods increase the risk of heart disease. Sugar promotes inflammation and weight gain. Trans fats raise bad cholesterol and lower good cholesterol. And excess sodium forces your heart to work harder. Processed foods are calorie-dense, but nutrient-poor, lacking the vitamins and minerals your heart needs. Heart-healthy tips: eat whole foods like fruits, vegetables, legumes, nuts, seeds, and whole grains. Choose lean proteins such as fish, poultry, beans, and plant-based options. Cook at home to control ingredients and reduce sodium. Limit sugary drinks. Opt for water, herbal teas, or sparkling water. Read labels to avoid hidden trans fats, excess sodium, and added sugars. Mistake number 3. A sedentary lifestyle. Modern life has trapped many of us in prolonged periods of sitting. Desk jobs, long commutes, and screen time have created a phenomenon researchers call sitting disease. Yet our bodies are built for movement. A sedentary lifestyle slows circulation, increases the risk of obesity, and negatively impacts both blood pressure and cholesterol levels. Why movement matters? Physical activity strengthens the heart muscle, improves circulation, and helps maintain a healthy weight. Lack of movement contributes to poor blood flow. Reduced circulation can increase the risk of blood clots and varicose veins. Weight gain. Even small amounts of prolonged sitting burn fewer calories, leading to gradual weight accumulation. Elevated blood pressure and cholesterol. Physical inactivity can lower HDL cholesterol while raising LDL cholesterol and triglycerides. How to incorporate more movement, break up long periods of sitting. Stand up every 30 minutes, stretch or take a short walk around your office. Take the stairs, skip the elevator when possible. Climbing stairs strengthens your legs and boosts cardiovascular fitness. Add brisk walks to your routine. A 15 to 20 minute walk after meals helps regulate blood sugar and improves heart health. Try strength training. Lifting weights or doing bodyweight exercises twice a week helps maintain lean muscle mass and metabolic health. Make movement enjoyable. Dancing, gardening, and recreational sports count as physical activity, making it easier to stay consistent. Dr. Reed stresses that even small, consistent actions accumulate over time. You don't need a gym membership or hours of exercise to make a meaningful impact on your heart. Mistake number 2. Smoking. Smoking is often described as a controlled demolition for your cardiovascular system. The thousands of harmful chemicals in tobacco smoke damage your arteries, heart, and lungs in multiple ways. How smoking harms the heart. Arterial damage. Smoking harms the lining of blood vessels, making them less elastic and more prone to blockages. Reduced oxygen. Carbon monoxide in smoke displaces oxygen in your blood, forcing your heart to work harder. Increased clotting. Blood becomes thicker and stickier, raising the risk of heart attack and stroke. Elevated cholesterol and blood pressure. Smoking increases LDL cholesterol and can raise blood pressure, compounding cardiovascular risk. Why quitting is so powerful. Benefits of quitting smoking begin almost immediately. Within hours, oxygen levels rise, blood pressure begins to normalize, and heart rate starts to stabilize. Within months, circulation improves, and over years, the risk of heart disease significantly decreases. Strategies for quitting. Seek professional support. Counseling, quit lines, and nicotine replacement therapy improve success rates. Use medication. If needed, prescription medications can reduce cravings and withdrawal symptoms. Adopt healthy habits. Exercise, hydration, and mindfulness techniques can ease the transition. Avoid triggers. Identify social situations or habits that tempt you to smoke and replace them with healthier alternatives. Stay patient and persistent. Relapses can happen, but each attempt brings you closer to success. Dr. Reed emphasizes that quitting smoking is the single most impactful step you can take for your heart, regardless of age. Mistake number 1. Chronic stress and anxiety. Chronic stress, called the master saboteur of heart health, keeps the body in constant high alert, straining the heart and arteries. It raises heart rate and blood pressure, boosts cortisol and adrenaline, and often leads to unhealthy habits like overeating, smoking, or skipping exercise. Stress can also affect mental health, reducing motivation for a heart-healthy lifestyle. Stress management tips. Practice mindfulness or meditation to lower cortisol. Use deep breathing to calm the nervous system. Stay active. Exercise relieves stress and boosts circulation. Maintain social connections. For emotional support. Seek professional help when needed. Managing stress isn't just about feeling better, it directly protects your heart. Taking control of your heart health. Reed's message is simple: you control your heart health. Much of the damage from poor habits can be reversed with consistent, small changes. Prioritize sleep, eat heart-friendly foods, move daily, quit smoking, and manage stress. Even modest improvements add up, lowering your risk of heart disease and stroke. Your heart is resilient. Care for it with smart, intentional choices, and you can enjoy a longer, healthier life.